So, thank you for staying on the AM show. Let's now talk about Ghana's COVID-19 cases and how health experts are worried about the surge in the numbers. I'll be having this conversation with Charles Nora, who is an epidemiologist, Dr. Fred Adomako Boateng, who is the Bunu East Director of Health, and Kwame Sapong-Esiedu, who is a CDD Fellow, and Dr. Esiedu Bekwe, Public Health Director, Ghana Health Service. Welcome, gentlemen. And before we zoom into our conversation, I'd just like to just do this brief presentation to understand where we were at the beginning of the year and where we are now. So here's what you see. Ghana's COVID-19 updates is a daily distribution of confirmed cases from January to June 2022, and our source is the Ghana Health Service. So when you take a critical look from the 1st of January 2022, you realize that there was a surge in the cases, and well, mostly attributed to the activities during the festive season. And we went up till about 600 somewhere in the first week of January. Then we began to see a decline all the way till March. And during this era, we had the mandatory face mask policy. Now, on the 26th of March 2022, that's where there was the new dispensation, the no face mask era. So you can see clearly there were virtually no cases being recorded. I mean, no cases up until the 14th of May 2022, where we began to see a gradual surge in the numbers. And now what we are seeing in June now is that the numbers are beginning to go up again. And so you see the gradual surge in cases. What does this tell us, especially about the decision by the president to lift the mandatory face mask wearing protocol and other safety protocols? So let's zoom into our conversation now. First off, we'd like to find out why we are seeing a surge in our numbers. It is important that we answer that why question. And I'll throw that question to Dr. Esiedu Bekwe, who is with the Ghana Health Service. Good morning, sir. Thank you for your time. Have we been able to establish why we're seeing a surge in our cases now? Okay, well, I'm told Dr. Esiedu Bekwe is yet to join. So let me throw that to you, Kwame Sapong-Esiedu. Do we now know why we're seeing a surge in the cases? Because the story was different from March, even up to May, April, May.
Well, it's very difficult to put a finger on any particular reason, but there might be a number of reasons. From the start, now people are not required to wear face masks, but that doesn't mean you must not wear face masks. And when the president made that announcement, that was one of the things I said, that the fact that it wasn't mandatory, that didn't mean that it wasn't necessary. We didn't make that distinction between what was mandatory, which was backed by law and an LI, and what was necessary to keep us safe. And the thing is, with COVID-19, it never totally went away. There was always a latent low-level infection rate going on anyway. But because it's a disease whereby a lot of people might be mildly symptomatic or asymptomatic, nothing was happening. My suspicion is that especially in Accra, with the rains coming in and the flooding, resulting in the fact that people have had to shelter indoors a lot more than they previously had, and therefore they are interacting more, people are getting more infected. And then the infections are affecting people who are more susceptible to go to the hospitals. And that is why we are having this uptick in our active case numbers. And why do I say so? I say so because currently Ghana is not actively testing. The only people who are being picked up are people who get symptomatic and go to our hospitals, which then means that they are only, you'd say, a third or even a fifth of who the actively infected people are, because that is how the disease plays out. About, let's say, 80% of people will be asymptomatic. So that should tell us that there is a latent infection going on and it's getting higher and higher and higher. And my suspicion is that if the rains continue and we have to stay indoors a lot more with poor ventilation, we're going to see a slight uptick. The last thing I would say is the saving grace is the fact that mortalities haven't followed the increase in cases. And that, my suspicion, is because a lot of the people who have underlying conditions have been vaccinated, which is a good thing. So they are getting infected, but because they are being vaccinated, their system is able to overpower it. And our health system, with our doctors learning how to manage COVID a lot better, because now the disease has been with us for up to 2.5, 3 years. These things are coming together to keep us safe. But ideally, what we should be doing is getting vaccinated more, wearing our face coverings more, and observing the protocols, even though they are not legal. And I think that would see us through this phase.
Let me go to Charles Nora now, who is an epidemiologist. And it's important that I ask this question because your job is to study these things and see how we can either slow the spread or prevent the further spread of these viruses. So you've been with the COVID-19 team that's been working in Ghana since we recorded our cases and the president decided that, look, let's come together to look at how we can halt this. Did we anticipate this? Because I'm sure that the president made an informed decision when he decided to lift the protocols. But in studying the virus and seeing how it works, did we anticipate that possibly during the rainy season we could have a surge in our numbers, as explained by Mr. Kwame Sapong-Isiedu? So how did we come to this point if we anticipated it? And what steps did we take?
So good morning to you and then to the panelists and the listeners. I think Mr. Kwamina has given a good background to it. Yes, we should say we expected this because, you know, after the easing of the restrictions, life was almost back to normalcy. And then all the preventive protocols that would help slow the infection were open or at the discretion of the general public. And because we had not ruled out the COVID situation in the country, it means that there were still some few cases lingering and that could spread. And with providing the conditions necessary for the virus to thrive when the flooding and then the rains set in, it was likely that we will begin to see some infections. Now, the good thing is that the Ghana Health Service had put in place measures of routine surveillance, and such that if you fell sick or fell unwell, you could get to a hospital, and there are systems in place that will pick such samples and test. And it is through these routine testing that we are able to pick up the numbers that we are seeing. Now, the approach should also now be that the virus has been with us for close to 2.5 years, almost 3 years. What should be our approach? And we should begin to learn how to live with the virus, and therefore making sure that our points of testing are made available to all the health facilities throughout the country, such that when people feel unwell, they could easily get tested. The good thing is also that the vaccines have helped to reduce the number of cases and then the severity of the disease. And, you know, the vaccine does not last for long. After every 6 months to a year, you need to take a booster. So if you also look at our vaccination coverages and patterns, yes, we have done well by giving close to 16,000 vaccine doses in the past. And that has also helped to douse down the cases. But as people live beyond 6 months, 1 year without booster doses, the immunities generated from these vaccinations begin to slow down, and therefore they will need to take booster doses that will help decrease the spread of the infection. So yes, we should continue with the surveillance component and making sure that we are doing testing, and the testing should be decentralized to all the healthcare centers. There are RGTs available now for COVID, and so it should be made available to all health facilities to at least screen people who show symptoms, and then we can then begin to isolate people who have severe cases from case management.
Now, I'm glad you mentioned the issue of getting booster vaccines, because we've heard people like Professor Awandare suggest that. Let me come to you, Dr. Fred Adomako-Boateng. You're with the Ghana Health Service. It appears we've seen a slowdown in the education, a slowdown in terms of, well, apart from last week, it's been a very long time we heard from the Ghana Health Service. Why aren't we continuing with our vaccination drive like we used to? And has it come up for booster vaccination drives as well?
Thank you for giving me this opportunity. I will want to even look at the graph that you are showing right now. Before I answer that question, if you permit me.
Please go ahead.
If you look at the graph, the mandatory face mask era, the last time that we peaked was almost around 26th of February 2022. You saw, and then for a long time, kind of we were not having cases. We're recording zero. And in epidemiology, if COVID had been any other pandemic, you would have declared that the outbreak was over.
Okay.
And this is how we go around doing it. If you look at the last case that you got, and then you add 2 incubation periods of the agents that you are discussing, in this case, COVID virus, the incubation period is 14 days. So if you multiply that 14 days by 2, you get 28 days. So the last time you got a case, if you add 28 days to that day, and then you are recording 00. Technically, in epidemiology, we say the outbreak is over.
Okay.
That is how we declare an outbreak is over.
So why didn't we do that?
But globally, the discussion has been going on, how do we classify and then have different ways of managing COVID. So for example, if you look at Blue East, for the past almost more than 6 days, we have not recorded a case. We are not recording cases. So technically, you will state, and COVID is different, you will state that, look, the outbreak is over. These are scientific laid down process of declaring an outbreak and therefore informing almost every decision. So based on what you have at that moment, then you can decide that, look, this is what we are seeing. This is the nature of the virus. This is the incubation period. And then looking at the context that we have, then we can say, look, we can decide to relax in these areas and that areas, and then look at the whole picture. You also bear that we also stated emphatically that, look, though we are going to relax in this aspect, the thinking was that we gave a caveat that by the end of June, this number of us should have been vaccinated. So the idea is that, and looking at the way we have, all of us have behaved concerning adhering to protocols, mass gatherings, the best option for the country now is for majority of us to really get the vaccines. And
that's why I'm asking, why the Ghana Health Service has slowed down on that drive. And also, we didn't hear anything about booster vaccines and how people who had already taken the vaccines earlier could get the booster vaccines after 6 months. We are hearing this from other persons who aren't part of the Ghana Health Service. And so I'm asking, knowing very well that this was the way to go, why aren't we seeing that energy that preceded the introduction of vaccines into the country?
We have had 3 cycles of NID, national immunization is for only COVID. In fact, we just came from 1 week. We started on the 8th of June, and we are ending. We were supposed to end yesterday. We are going to do mop-ups for 2 other days for those who couldn't catch the targets. Not only that, we have done other 2 NID days. So we are doing, in fact, if you, I'll share some pictures. Some of the districts, we go there in the evenings when people have returned from their farms to be able to get them. So we are really vaccinating, and then on the camp on campaign spree. Just that the media landscape and what has caught the attention has been less of COVID, but at the service we are actually vaccinating. And the current one that we did, is we were able to hit almost 50% of the target. So in terms of the campaign we are doing, in terms of those that we are supposed to give the boosters, we have stated those who qualify for the boosters. All health workers are also qualified, and people who are having other comorbid more than 60 are also qualified, and pregnant women. So we are doing the campaign all right. Our challenge has been for us, the pregnant women, and then the other age groups, initially less than 18, who were not part of it. You see, when we started the campaign, and the rates at which we were campaigning that, look, pregnant women are not part, people less than 18 are not part. When the research actually came out to say, look, it's safer for them to receive, and actually the benefits far outweigh the side effects, the other challenges that they will have if they don't have. It's difficult for them to now even come on board. And they're having that thinking that, look, we were not part of it, but we are part of it. So if you look at the dynamics of what we are having at Bunois, the challenge has been with that age band, pregnant women, and then less than 18. That's where we are having the challenge.
Because it's good that you raised the issue of pregnant women and children, because quite recently we've seen the concerns, especially in schools. I mean, we did in a paper review this morning, a school in Kaswa having to close down over COVID scare. And so I appreciate that you brought in the bit of concern when it comes to children being vaccinated. But let me bring in Mr. Nora at this point. So you said we anticipated this, and so it's not a surprise to you. So where do we go from here? What are we likely to see if people still do not adhere to the protocols and receive the vaccinations that we are encouraging them to?
Right. So if you noticed, our neighbors, our neighboring countries are still also recording cases, and our borders have been opened, our land borders as well. So there's movement, free movement around the borders. So technically, most people, the virus will not, who have the infection will not still show symptoms. So they cross in the borders, and then they are able to transmit or infect others. So we are importing cases as well. And then also, if you check the data from the airport that we are still testing, there are some few cases that are still being imported. These ones are adding up to the ones that we had locally, that we were seeing local transmissions and picked by the routine surveillance. And like Dr. Adumaku rightly mentioned, the routine surveillance one, we're seeing 0 cases for a prolonged period of time. But the people who were coming into the country, who were tested positive, and who some were not going through the test, were able to shed the infections. And once we began to gather, churches, schools, the marketplaces, and all of that, with the rains coming in, a single case could propagate the cases. And that was some of the issues that we needed to make sure that at least the education that we started with the energy and the media coming in, we are still able to educate the people. I mean, you can observe from our chop bars, the way we used to have Veronica buckets all around, hand washing, sanitizers, people sit in vehicles and they have their sanitizers, they are careful. Now we have thrown caution to the wind, and therefore a single case. And if you observe, it started with some influenza-like illnesses across the country, and together all these are viruses. So, and the mode of transmissions are the same. So these were some of the things that when you observe, we could anticipate that yes, we're going to have some of these challenges. But the good thing was that the surveillance were put in place so we can pick them early, and then we can be able to manage the case.
So Mr. Nora, if sorry to interject, if the attitude remains the same, what are we likely to see in the coming days?
Yes, so if the attitude remains the same, we are likely to see an upward, the continuous rise in the cases and the positivity rate. So we need to really educate the people and make the public know that, yes, we have eased the restrictions, but the preventive measures should still be with us. We should continue to sanitize, we should continue to do our hand hygiene and make sure that we have the water running through. We also make sure we are still wearing our face masks. I mean, the continuous education and appeal to the public is important to make sure that we deal with the virus. And we should also be testing at all the facilities, make testing more accessible to the general public.
Okay, so let me just bring you some more statistics here. So we are comparing the mandatory era to the optional era. And as you can see here, this is March 27, 2022. There were 160,925 cases. June 11, 2022, 960 new cases added, taking the number to 161,841. Mr. Kwame Sapong-Essiedu, would you say that considering what we've just been told by the Bono East Regional Director of Health, that ideally, if this were any type of pandemic, considering the figures I showed earlier, the trend of infection, we would have declared the pandemic over. It appears that COVID is being treated very differently. So based on that, would you say that maybe we relaxed or eased our restrictions too early? Hello, Mr. Sapong-Essiedu.
Hello, can you hear me?
Yes, I can.
Yes, I wouldn't say that we relaxed too early. If you look critically, at the time we were relaxed easing of restrictions. That said, Dr. Adimako is also right with the calculations that are made in epidemiological modeling when you have 0 cases. But there's one caveat there. That is on the basis that you are actively testing, especially for a respiratory disease like COVID. But because globally, it is accepted that most countries cannot actively test because testing is expensive, that particular calculation hasn't been used because there are sporadic outbreaks and spikes going on. And with the global travel arrangements and with airport restrictions eased globally, it's only a matter of time for someone to be infected in Ghana to fly to the UK or someone infected to the UK to fly to Ghana. But with all that in mind, you cannot also continually restrict the general population because apart from the economic implications of doing that, there is the psychosocial implications as well, mental health, human behavioral changes and other things, which would also harm our health system if they were done unsustainably. And therefore, at the time the restrictions were done, because we had enough vaccines available, my thought was that we were going to ramp up vaccinations. And with ramping up vaccinations, that would have meant that even if we had a spike in infections, our hospitalizations would be low. That so far is holding, like I said in my first submission, because if you look critically, even though we are having a spike in cases, we are not having a spike in mortalities. which has been the trend with all our waves, which is a good thing. Because I'm quite sure, I've not got access to the data at the minute, but I'm quite sure Dr. Adomaku may be able to give us data to show that a lot of the people who are getting hospitalized fortunately have had a vaccine or two, which then means that they have a latent ability to respond quickly compared to when COVID came and that too, the vaccine wasn't there. So that it's a very, very tricky situation when you look at it that way, to say, if we are not vaccinating, then do we lock down? Or if we are not locking down, should we ramp up vaccination? The Ghana Health Service, from what Dr. Adomaku is saying, is trying to do its bit. The question is, as a society, are we up and doing when it comes to vaccine uptake? I think there's still a high level of vaccine hesitancy from the little I can see, especially amongst the school-going age group, and that cohort needs to be addressed, because it looks to me that the latest uptake has come. It started in that cohort and they've taken it home. And now the people with underlying conditions are picking it up and getting hospitalized, even though they are vaccinated. And so the only way we'll be able to break that chain is to actively vaccinate that age group in the schools, because they are not wearing their masks, and you know that for a fact.
Doc, the conspiracy theories haven't ended. There are those who say, oh, don't mind these health people. They're beginning to lose out a lot. They were cashing in on the virus and all the news around it. And so when the Russian-Ukraine war started, all eyes, turned away from COVID. They're doing this so that they could just cash in a bit more. And really, I mean, from the statistics we've shown, there's some who say, why the fears? Even the numbers, look at the numbers. There's really nothing to fear, is there?
No, there is. Let me do a quick myth busting. At the outset of the vaccination, we were told that the vaccines were being developed to kill us in Africa. And we heard the bro, ha, 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 ha. Now we found out that the vaccines are safe. And in fact, the people who developed the vaccines are even vaccinating kids as young as 5 years. My son, who is 5 years, is vaccinated. Now they are saying, oh, because of the Ukraine-Korean war and with the spotlight of COVID, they have deliberately said that there are new cases. I mean, let's get real. Would these conspiracy theorists not stop at anything? Can they stick to the original story that the vaccines were developed to kill us? If they can stick to that, then we can peruse the data and say, this is the number of vaccines that have been given in Africa, and how many people have died as a result of vaccination. But if they continue to shift the goalpost, as they're doing now, then we would never be able to bust their bubble, because every time they'll have a new story. And for me, every time they have a new story, that story is not scientific. And I think that is what, as journalists, you need to be putting out. That they just shift the goalpost and they don't do science, they just do conjecture. And for me, I don't dwell in the realm of conjecture. I'm a numbers person. That is what my training gives me. And so if they want to talk the numbers, we would talk to them. But if they want to speculate, I wouldn't go into that level of conjecture with anybody, because it's not my strength.
Thank you for your time here this morning, Kwame Sapong-Siedu is a CDD fellow. I was going to ask you what steps you should take, but you've already mentioned that. So let me move to Dr. Adomaku. So here we are in a country, people getting infected, some thinking, oh, this is all conspiracy because the Ghana Health Service itself has slowed down on its vaccination drive and all that. So you say you've been having a series of meetings. What should we expect in the coming days with regards to what we just heard Mr. Sapong-Siedu talk about? His suggestion that we should be looking at young people now, people below the ages of 18, below the initial cohorts that we were focusing on. What is the agenda of the Ghana Health Service when it comes to vaccinating those groups of people?
I think that decision will be taken by the head and then the Ministry of Health. But
so as we speak, you're saying that there's not been any meeting on how to address the issue?
Less than 18, 15, they are supposed to have the vaccines.
Okay.
Our challenge is they taking it. And that's what we are looking at, how to address that. For Bono East, the next campaign, we are just going to have another campaign. We will launch it in one of the senior high schools. Basically, we are thinking of Kintampo Senior High School.
Okay.
That's what we will do. And we are continuously engaging the other group. Last week, I was in Atebubu, Amantin. We went to almost all where we have the antenatal care clinic. I think the engagement with the pregnant women, we also will have to increase that engagement. If you're able to do that, I think the uptake will actually go up. For now, we are having about, as Kwame said, we are having 11 active cases, and almost all of them are vaccinated. We are happy with that. If you look at our figure, our Bono is now almost 50% of those who are eligible for the vaccines have been able to take it. So it means that if you take any two people, one of them is vaccinated. And if you're having all of them vaccinated, having the cases, as compared to those who are not having the case, I think I'm happy in that vein. What we will have to continue is that we have to drive that campaign. And we are doing it. We have a lot of other even partners supporting us to be able to double up in giving the vaccines. That is the surest way to go, because the others depend more on behavior. It is difficult for somebody to always be in the mask. When it's 0, you want them even to be in the mask. When it's high, you want them to. So the best way that we can really do is that, look, let's be protected chemically, which is one of the surest way of prevention. And so we are not sleeping like you, though we are not coming. We are working hard behind the doors, making sure that people will be able to get the vaccines. So the month of June is our vaccine month. And I think the Ghana Health Service is having a target of at least not less than 4 million people will be added on. So it's a drive that we are still on. That is the best bet for us. And I think we should continue. We are still going to have different ways of targeting the young people. They are strong. When they get it, they don't come down. How do we really convince them so that they will take it and protect all the rest? That is what we are thinking about.
Doc, just to be sure, the vaccines are still free, right?
Yes, please.
All right. Thank you very much, Dr. Fred Adomako Boateng is Bono East Director of Health. Earlier, you heard from 2 other people, and we've been having this discussion about COVID. Kwame Sapong-Esiedu is with the CDD, and Charles Nora is an epidemiologist. Unfortunately, we couldn't raise the Director of Public Health, Dr. Franklin Esiedu-Bekwei, on the line. We would have wanted him to answer a few questions, especially when it comes to the next move, talking about vaccination and what our agenda is. Hopefully, when we raise him, we'll let you know what the Ghana Health Service is doing. But that will be it for our conversation this morning on COVID. Please stay safe. And remember, you can walk into the nearest health facility and ask for a vaccine. Shortly, my colleague Benjamin Akapo will be back. We'll be speaking to Musa Superior. The NPP is gearing up for its national executive elections. He'll be back to have that conversation to stay.